Hi, my name is Adam Funk, and I'm an attorney in Houston, Texas, who specializes in birth injury cases. Today, I want to talk to you about what to do if you believe your baby is experiencing developmental delays. First, let's talk about what is a developmental delay. Typically, what it means is it is a baby who isn't reaching his or her milestones. Those milestones could be physical, could be verbal, and could also be cognitive. For example, if your baby has not yet started crawling by a certain amount of months, if your baby has not talked after a certain amount of years, if your baby was not swallowing in the correct method, these are all developmental milestones that can be reached at certain points. Now, there's obviously some flexibility in the number of months and the number of years. Every baby is different. However, there is a consensus amongst pediatricians as to the very maximum that a baby's age should reach before he or she actually starts doing some of these actions. For example, if your baby has not been crawling by the time he or she is 1 or 2 years old, then that might be considered a developmental delay. So, what do you do as a parent if you believe that your baby has not reached its milestones? First and foremost, the most important thing is make an appointment with your pediatrician. Your pediatrician is your first stop. He or she will then review everything on your baby, ask the important questions, evaluate your baby, and then determine whether or not some sort of early intervention is necessary. If early intervention is necessary, you will likely be referred to a specialist. That could be a pediatric neurologist, that could be a pediatric orthopedist. The pediatrician will direct you on where to go. A early interventionist will be the person who guides you through various types of therapy. Speech therapy, occupational therapy, and physical therapy are the three main therapies that should be started early on if developmental delays have been seen. Once that therapy begins, your other doctors may be able to help you out with pharmaceutical medications or other therapies that might be necessary. The third step that you should take is obtain all of your records. Get them from the hospital, get them from your pediatrician, and continue to keep them for every single therapy session. Take pictures, take videos, show the progress. That way you can document and show future medical providers if it is necessary. Lastly, if you believe that developmental delays occurred because of some sort of birth injury during labor and delivery, call a lawyer. It's very important to start talking to lawyers early on due to certain time limitations that you may have in different states. My name is Adam Funk. I'm one of those lawyers, and I would be happy and honored to speak to you if you believe that your baby is having developmental delays and it might have been because of labor and delivery issues.